A measurement plan is best when based on a theory of change, and in essence lays out what should be measured in an organisation and how. It may seem difficult to know where to start, but in the theory of change each element should be measurable, and by attaching measurements to the elements, a complete system can be outlined. To illustrate, let's go back to our rooftop garden example. Their first chain links health as an outcome to group gardening as an activity. To quantify measurements, it's best to work short to long term, as longer term results are generally trickier. Starting with group gardening, to measure the rooftop garden project's outputs, or how much of this activity they are providing, the number of people attending group gardening, as well as the number of hours spent in group gardening, can be used. Next, physical activity can be measured as time spent doing an activity and how much exertion the activity demands from the user. Moving on, better sleep patterns can be measured by the opposite. How many sleep incidents happen per month? Weight loss or weight stabilization is a weight measurement. Easy. Improved fitness can be measured by the improvement of the physical activity indicators over time. Finally, better health is the longest term. Again, looking at the corollary, someone with poor health visits the GP often, so the measurement could be the reduction in number of GP visits. To check if your measurement plan makes sense, see if you can tell a story. Since joining our program, the client has increased the time spent outside and their physical activity. In doing so, they have lost weight, started sleeping better, and are completing more demanding tasks with their improved fitness. This has led to improved health. The user is sick less often, and therefore has reduced visits to the GP. The next step is to take these measurements and work out how to implement them. To do this, you need to know how to get a baseline measurement and how to continually take measurements. In this case, a starting questionnaire or interview with a primary carer can probably cover most of the baseline information. What physical activity is the user involved in weekly? How many sleep incidents does the user have weekly? How often does the user visit the GP, etc. For continual collection, the attendance register and activity checklist can cover off attendees, time spent, activities, and their difficulty, which completes collection of 4 of the measures. Almost all of the rest can be collected by asking carers quick questions when they come to pick up their clients. For example, if the user has visited the GP in the last month, or if they've had any sleep incidents that month. Just remember, you don't have to measure or have a measurement for everything if the story can be told with less, so don't worry if you get stuck on an element or two. Also, when in doubt, a case study can illustrate many of the more difficult to measure outputs. Just remember, break your measurements down using the theory of change. Make sure you can tell a story with them, and keep it ASAP, as simple as possible.